Hi, my name is Dr. Joanna McDowell. My background is in clinical psychology, and I have worked with veterans with co-occurring substance use and mental health disorders in both outpatient and intensive outpatient settings here at the VA. I'm also involved in research that examines this relationship or this co-occurrence with substance use and mental health disorders. So I can talk a little bit about the different pathways that can lead to both substance use disorders and mental health. So in general, there are these common factors, risk factors that both of these disorders have individually. And then for some folks, both are on board, then it can lead to a much larger risk. So if somebody in your family has one of those disorders, it might be more likely that you or somebody else in that family would also have it. So you could think of it as that disorder or those disorders run in the family. Um, and another important risk factor is when it comes to stress. So both stress and trauma can lead to the development of either a substance use disorder or mental health independently. And kind of thinking about how those things could all mix together for somebody who already has it, family history of one of those disorders in their family, encountering a really stressful event or encountering in trauma could really increase that risk for that disorder developing for them. Yeah, and so for somebody who already has a family history, being in those stressful environments or having a trauma could lead to development of both a mental health disorder as well as a substance use disorder. Another pathway that we know about is you could think of it as like the coping model or the coping pathway. For folks who already have a mental health disorder, they might turn to alcohol or drugs in order to try to manage some of the symptoms that come up. You might have heard this be called like self-medicating. Um, and just to paint an example, somebody who has PTSD and is experiencing nightmares and sleep disruptions related to that, they might drink a lot before bed as a way to pass out and then also maybe not have the nightmares. However, what we know about alcohol use and sleep is that although you might easily fall asleep or feel that you're staying asleep, you're actually not getting the same REM or that kind of quality of sleep is reduced. So for this person, although they're drinking to try to sleep better, actually the drinking can lead to them sleeping more poorly. It can also lead to kind of the prolonged nature of those symptoms for them. And then on top of that, right, the repeated drinking could bring on an alcohol use disorder. And so that might be an example of the coping pathway that can come up for folks. Another way that both of these disorders develop is if somebody already is actively using a substance and having difficulty managing that, that the kind of consequences related to the repeated substance use could lead to a mental health issue. So we can use alcohol as an example for this one. Alcohol is a substance that affects our central nervous system. And it has actually two types of effects. There's stimulating effects and then there's depressant effects. A lot of times people turn to alcohol use for those stimulating effects. You might think like, okay, I drink, I feel a little bit more talkative, I'm more engaged, I don't worry as much, right? You might get that social lubricant. But as I mentioned, eventually will come the depressive effects. And those are things of like feeling really sleepy or maybe more irritable or really wanting to isolate. So somebody who is drinking and they keep drinking, after a while, those depressant effects might get longer or get more extended. And being isolated and experiencing those depressive symptoms could lead to actual development of a later depressive disorder.